Look, as the department, as you might have heard from the previous speakers, that we should be biased towards the LGBTI, taking cognizance that there's a high prevalence of your infection and transmission. And, like as the International AIDS Conference, confirmed that by 2030, we don't want any AIDS epidemic, in the world. So as a country, Gauteng, we have taken some initiative to say, let's work together with this community, make sure that we deal with the stereotypes, but then acknowledge the fact that they play a significant role in our society, make sure that our health professionals, they have a know-how on how to manage this sector when they interact with them. And then we had a partnership with OUT, like as we have already indicated. We've opened a clinic with them in Hatfield. They accommodate, all of the sector, just making sure that they take care of their needs, because we will know that when you go to our clinics, the stigma is still there. People are not attended to like as they were being sawn at, and nasty words are being pelted against. So we felt that let's form this partnership in Ekurhuleni. We're working with ICAP just to make sure that they have their foot soldiers on the ground on HIV and AIDS messages, how to interact in a very safe way. Distribute condoms, assist us to run our messages through them. But then what is important is that we are funding them as well, just to make sure that they assist us to run. And in Johannesburg, we also have a center where we are attending to such a community, just to make sure that they are well taken care of. We're expanding. We're going to go to Sedibeng and the West Rand. But we have identified the 3 areas. That's where we saw a high number or a high prevalence of the LGBTI, going around in the area. So we are more in partnership than doing it by our own. Make sure that we acknowledge the fact that the Constitution allows anyone to be in the country, anyone to choose how they want to live their life.
Yes.
No sexual orientation must be a reason for people to be precluded from the services. Most especially the public health care is quite detriment, because each and every one must be healed. And it's very important for people to come out and be assisted.
Healthcare providers, public health care providers, do we have enough of communication with them directly about this and overcoming the stigma?
Definitely. Like in Gauteng, for now, we have trained about 40 of our facilities. All their health workers and the health professionals, they've been trained to have a know-how on how to attend to, because sometimes one will not be open to say, this is my challenge, and with the stigma around, one will not be open. So they will be in a position to can interact with them. When they do the checkup, they will be in a position to go and check in all the areas that they will need to be checked, and so that you don't misdiagnose someone with, and those are the things that we're looking at. We're going to be expanding. In Gauteng, we want actually to move away from having a clinic that is, solely for LGBTIs. We want to have our facilities. When you go in there, you should not be segregated. You should not be discriminated against. Our health professionals should be in a position to can attend to you without alienating you, because we are looking at a bigger picture. Yes.
Is it a question of opening this kind of thing to all men? Because there's the flip side of the coin now, is that some people say that specialized clinics for M2M would be discriminatory against straight men, for instance.
No, like as the J has already indicated, that you will have people who will be saying they are straight, but come at 9, they call it after 9, in the lingo, that one will then have, one will be an MSM, So most of men who come to our facilities or those facilities, some they would not even indicate that they are MSM. They will just indicate that I'm here suffering from this, but also have an understanding that generally men don't consult. Men, we don't go to doctors, we don't go to clinics. So we'll encourage men to also go to these facilities. But then by having a specified one, we are not saying we are segregating, because we are in partnership. The one that is in Soweto, it's ANOVA, it's involved there. We are working with them, make sure that we support them. But then we are not saying this is the model that we are looking at in the near future or in future, because we are looking at a public health care should be a public health care for everyone who lives in the country.
And the clinics right now, what you've introduced, what's been the response and what do you think has been the effect so far on the community?
Look, it is quite positive. I mean, we're seeing about 2,000, at these clinics of your patients. So looking at the province, look at that figure, and in the 3 areas that we are operating, and we will be moving to Sidibeng and Western. So we are very confident that they are being utilized, and we will encourage those that don't feel comfortable in going to the sectors that people are not trained, they must utilize those.
Stephen, it's fantastic work. It's a fantastic idea and it's having a real effect. Stephen Mabona is a spokesperson for the Health MEC here in Gauteng. Of course, we're talking about access for the LGBT community to healthcare, and they've come up with a very good solution. Thank you for joining us once again this morning. Now, the United Nations General Assembly declared today, the 3rd of March, as the day of the signature of the Convention on International Trade in Endangered Species of Wild Fauna and Flora. World Wildlife Day celebrates and raises awareness of the world's wild animals and plants. The theme is the future of wildlife is in our hands. Let's take a look at our tweets with regards to this day. Beautiful pictures we have there. Now, is that Mridu says, we have done too much of destruction for millions of years now. It's time to at least think. World Wildlife Day. Yes, it's a little bit late to start thinking. We need to start acting. Shruti says, World Wildlife Day. Let's remember that we are part of this world and every species deserves this planet as much as us.